Welcome to Spotlight on Pelvic Health, brought to you by pelvicpainrelief.com, the only online school that brings pelvic healing and training to the privacy of your own home or office. And today's question is pretty fantastic. I treat a lot of patients who suffer from this, and I've come up with a really beautiful way to treat it that's very effective. And the question comes from a physical therapist. She goes, I have a patient who is suffering from pubic symphysis dysfunction, and every time she moves on my treatment table, every time she goes from sit to stand, she has a lot of pain. What can I do to help her? In this segment, I'm going to share two things for you that I do that can bring an immediate pain relief to your patient. One of them is that I do an alignment for the pubic bone. If there's a separation in the pubic bone, if there's pain in the pubic bone, typically this bone is also out of alignment, and what I'm demonstrating here is sort of the cartilage between the two bones, right? So you can assess to see whether it's in alignment by just putting your thumbs directly on top of it, and you'll see that maybe one side is higher than the other, which is the typical finding that you will find in either postpartum women or women who are pregnant who suffer from pubic symphysis dysfunction. So the first technique that I'm going to show you is a shotgun technique. And the shotgun technique is a muscle energy technique that helps to get the bone, the pubic bone, back into alignment. And this is what you're gonna do. It's very simple, okay? And you're not gonna hurt your patient. So the thing that I would do is I would resist the outer thighs abduction. So I would resist the patient. She's sitting in good posture or in a hook lying position. Resist abduction and have the patient press out into your hands for 10 seconds. I would repeat that 3 times. Make sure that the legs are hip width apart in someone who's suffering from pubic symphysis dysfunction. You don't want to do any exercise that really brings the legs very wide. That would increase their risk for more pain and more injury. So the legs are hip width apart. You're going to resist abduction 10 seconds, 3 times, okay? Then you're going to take your fist or a yoga block or a pillow, whatever is best, and you want to teach your patient how to do this also. And put the yoga block or the fist between your patient's knees and have your patient press inward for 10 seconds. And repeat that 3 times. Now, typically when you do this, especially the resist the inner thigh, because as we know, the pubic bone is the house for the inner thigh muscle. So we're using that to correct the alignment. Sometimes you can hear like a little pop or a little sort of like snap back in, and that's a good thing. Then after I do the alignment, of course, I've done many other techniques already. I've worked on their body. I've checked other parts of their bodies. I've done work with the pelvic floor and with the abdominals. And now I'm up to the part where I'm doing the corrective exercises. I do the resisted abduction and adduction, which is called shotgun. And then I will introduce something like this, which is a Sorolla belt. It's an SI belt. And this brings a lot of pain relief to women who are suffering from symphysis pubic dysfunction. So you would put the belt around your patient's greater trochanter. Sometimes it's either a little bit above or a little bit below, and you sort of are compressing the bones inward. One of the things that you want to do, and I'm not sure if I can actually stand up here, is when you do wrap it around, a lot of people are wearing it here, and, you know, they're wearing it all wrong. So you want to make sure that it's comfortable for the patient and that it's providing pain relief, okay? So you squeeze it. After you do the alignment, you put the belt, the pubic symphysis is right here, so you're bringing the bones together to create stability until your other programs kick in. And I'm talking about exercises, because there's exercises you can do to create more stability during pregnancy and the postpartum period for a woman who's suffering from pubic dysfunction. And then you're going to make sure that you can at least put one finger in. So you don't want it super tight. And then you're going to watch the patient walk. Does it bring them relief or not? Because maybe they're not a candidate for the belt, but maybe they are. In my experience, Belting and correcting really provides a lot of stability and it decreases the patient's pain. So these are my tips for you today. Please use them. If you have any questions, don't hesitate to email me at Isa Herrera, Herrera, at pelvicpainrelief.com. I really make an effort to answer all the emails, and I also read every single one when they come in when I have time. So if you have questions on this technique, don't hesitate to reach out. Thank you, and I hope this brings your patients relief.